All right, let's get started. Thank you, everybody, for joining today's Healthcare Sector Pledge Initiative webinar. My name is Christina Bagdikian, and I'll be facilitating today's session. To let you know, the webinar is being recorded, so if your colleagues aren't able to make it, it will be posted on our Pledge Initiative webpage here in a few days. So if you want to go back and reference it, hang tight and it'll be posted in a few days. Today there isn't an unmute function, but we do want you to ask questions. So please go down to the bottom of the screen. You should have a QA box and type in the questions there. You can use the chat box for chiming in on or commenting on things, but if you have a question that you want answered, please use the QA function at the bottom of the screen. And if we don't get to your question at the end, which we're going to try to get to as many as possible, please send them to OCCHE, OCCHE at HHS.gov, and we'll get back to you as soon as we can. We recognize some questions may also be very specific to your organization, and in that case, you can feel free to pop it in there, but we'll probably answer those via the email too. So again, OCCHE at HHS.gov if we don't get to your question at the end, and we will do the best we can to get back to you promptly. All right, without further ado, I am going to hand this off to John Balbus. John, are you ready?
I am, Christina. Thank you so much. Thanks for the introduction, and a huge thank you to everybody who is joining us today, and an even bigger thank you in advance for all of you who are joining and are seriously considering signing on to the pledge or have already signed on. My name's John Balbus. I'm the Interim Director of the Office of Climate Change and Health Equity, which we are referring to as OCCHE, and we are the coordinators of this healthcare sector pledge being done on behalf of HHS and in close partnership with the White House. I'm very pleased to open up and to provide a little background and context to the pledge, and then I'll hand it over to Joe McCannon, who is our lead on healthcare sector decarbonization and resilience. And we'll try to get through this quickly so that we can get to your questions and have a good discussion at the end. So the starting place is right here, why it matters. And one of the most stark depictions of why action on climate change matters, including from the healthcare sector, was the Intergovernmental Panel on Climate Change 2022 Impacts Report, which came out last February, which documented widespread changes that have already occurred in major Earth systems like the coral reefs, like glaciers, like sea level rise, and ocean acidification, changes that are already happening and that make it so urgent for all actors on the planet to start reducing greenhouse gas emissions and taking climate change seriously. But the flip side of that warning, or that alarm, if you will, from the IPCC report was that there is still time to make a huge difference in what happens. And that's why we're here today, to be part of the solution, to be part of an HHS effort to make the health sector part of the solution to the climate crisis. This is reflected in the fact that this is an all of HHS effort and a mainstream effort of the healthcare sector is reflected in the fact that over 200 of the world's leading medical journals published a joint commentary and labeled climate change as the greatest threat to global health and called on all healthcare actors and public health actors to start addressing the climate change threat, both in terms of reducing and protecting people's health and reducing the impacts on people, but also in terms of decarbonizing the health sector. And at the same time, there's a really important message that we need to make sure we are all talking about, which is that decarbonizing both the health sector, but reducing greenhouse gases, especially from fossil fuels, but many different measures to reduce greenhouse gases have substantial health benefits. And in fact, the benefits, the economic value of the benefits that just come from reducing air pollution associated with fossil fuels in an effort to reduce greenhouse gas emissions that economic value of the health benefits is greater than the cost of the reductions themselves. So a very, very important point for us as the healthcare sector to be making to the rest of the world, that there's a huge health reason to be reducing greenhouse gas emissions, especially from fossil fuels, and that the economics work out in benefit of action rather than inaction. So the time is now to take action. Many of you have already seen this, but I just want to make sure we're all on the same page, understanding that the health impact side, the health impacts of climate change are numerous. This is a graphic that comes from our colleagues at the CDC that shows in that inner circle the manifestations of climate change in terms of Earth systems, in terms of rising global temperatures, more frequent and severe extreme weather, rising sea levels, and increasing CO2 levels in the atmosphere, as well as acidification of the ocean. These changes impact health through numerous different pathways. In that next circle are 8 of the pathways, ranging from real direct, easily understood effects like heat waves and hurricanes and floods, over to more indirect effects like the change in air quality from, for example, drought and the exacerbation of wildfires from high winds and high temperatures, to things like changes in vector ecology and even in changes in allergens associated with changes in the timing of the seasons, changing in the coldness of winters that allows insects to survive winters where they didn't used to be able to. Even the changes that come from the direct effects of CO2 in the atmosphere, which changes the features of allergens and also changes the nutritional quality of a lot of staple food products. So many, many different impacts of climate change on health, such that no matter where you are in the country, your health system is likely to already be seeing these, and if not, will be experiencing these changes in severity or the distribution of these health effects in coming years. And equally important is the fact that not everybody is exposed or bears the same burden from climate change health impacts. This is another slide borrowed from colleagues at CDC that makes it very clear that the changes in outcomes and risks associated with climate change are very tightly linked to the same factors that have been the focus of the environmental justice movement for many years, and I would point out are exactly the same kinds of factors that are responsible for health disparities in terms of COVID-19 outcomes. So this includes exposures being placed in, either through occupation, as happens so much with COVID, also happens with climate change, or through systematic discrimination and financial racism associated with practices like redlining that led to communities of color and low-income communities, recent immigrant communities, being placed in harm's way, frankly, whether that's proximity to roadways and being exposed to air pollution, which harms health directly, but also makes people more susceptible to COVID, or being in areas that are subsequently cited for industrial facilities that have poor access to food, are known as food deserts, have poor quality housing, or like we saw in Hurricane Katrina in New Orleans, inadequate physical infrastructure in terms of the levees, such that many communities of color bore the brunt of the flooding there. And of course, this CDC diagram recognizes that those differences in exposure, those differences in vulnerability, differences in adaptive capacity are tied to upstream root causes like racism, historic disenfranchisement, unequal distribution of power and resources. So as we think about the role of the health sector, as we think about the mission of the Department of Health and Human Services, and the mission of our office to protect the health of the American people, especially those most vulnerable, there's a real important understanding and a real need for the health sector to be thinking with a health equity lens in terms of the actions that need to be taken to both reduce greenhouse gas emissions and the co-pollutants that go with them, but also to ensure that our systems are up to the test in providing services and able to take care of people's health needs. So with that as quick context, our Office of Climate Change and Health Equity was one of the mandates given to the Department of Health and Human Services under Executive Order 14008, tackling the climate crisis at home and abroad. The other two being setting up a new interagency working group on protecting vulnerable populations and a healthcare systems readiness advisory council. We divide our work into three priority areas given the mandates and the needs that I've been laying out in terms of the threat to health. Our first priority is that mandate to protect the health of everybody in the United States and its territories and its tribal areas from the health impacts of climate change, but with a focus on those most vulnerable, those bearing the greatest burden currently and likely to bear that greatest burden in the future, to focus on those who are being placed in harm's way. The second priority action resonates with what's going on now with COVID, this understanding that the disparate outcomes from COVID, the disparate access to information, the disparate access to healthcare even, is closely tied in with underlying social determinants of health. And especially if we think about the role of something like air pollution or occupation in terms of COVID disparities, those same factors impact people's vulnerability to climate change outcomes. Pardon the dog, of course, the timing is not good. And so our second priority area is to harness actions that are ongoing in other sectors in order to reduce health disparities by addressing those social determinants of health. And then lastly, our third priority is the direct work that we're undertaking with the health sector on decarbonization and health sector resilience. All of this underlain, of course, by data, development of indicators, analytics, communications and outreach like our webinar today, and training. So with that as backdrop, this is our vision where we need to be as a country in a very short time, because the crisis is very urgent. The first element is that every healthcare facility type in the United States needs to be prepared for long-term operation in the face of weather-related disasters. We're seeing time and time again that when hurricanes, wildfires, and other severe weather extremes are hitting an area, that when the health systems fail, people die. People die during evacuation. They die because they're not getting essential dialysis or cancer treatment or other essential treatments. So we need to do better in terms of the resilience of our systems. The second is that the health systems in our communities and our healthcare workforce is prepared in terms of training and in terms of resources to deal with the health impacts, both the sudden disruptions, but also the chronic climate impacts associated with air pollution, associated with some of the infectious diseases, et cetera, with a focus on the most vulnerable populations. And then lastly, that the health sector as a whole, every hospital, every health system, has started in making its commitment to reduce its own emissions, which is exactly what we're talking about today, by publicly tracking the greenhouse gas emissions and setting a path to net zero by addressing both the emissions that come directly from operations, which is known as Scope 1. So that would be things that come out of a combined heat power or an incinerator on site, or leaking of anesthetic gases, for example. The indirect emissions associated with energy use, which is Scope 2, and then all those other indirect emissions associated with the supply chain, with patient transport, et cetera, which would be Scope 3. So with that as a vision, our office was established just at the end of August of 2021, and just a couple of months later, our Assistant Secretary for Health, Admiral Rachel Levine, was in Glasgow leading a delegation from the Department of Health and Human Services. And here she's shown with the permanent Fijian representative from Fiji to the United Nations and the head of the WHO section on environmental health that's addressing climate change, making commitments to the COP26 health program to specifically be working on the resilience of communities, the resilience of health systems, and also on setting us on a path to a low carbon or zero carbon health systems in the United States. And shortly after the announcement at the COP and the setting of those commitments on behalf of the United States in December, Executive Order 14057 came out, which calls on all federal facilities to meet decarbonization targets to be on a path to net zero by 2050, in line with the Biden administration's publicly addressed commitments on behalf of the United States back on Earth Day 2021. And of course, many federal agencies run major health systems like the Department of Veterans Health Affairs, the Department of Defense, the Indian Health Service, etc. And so our office is working inside the federal government. The federal government is walking the walk to decarbonize our own federal health systems. So with that as context, that's how we come to the pledge, because of course, 90% of the US health system is private. The federal government doesn't control the activities, which is why we're looking to partner in a very comprehensive and robust way to move the country as a whole towards these goals. And with that, it's a pleasure to turn it over to Joe McCannon, who is our lead on the health sector decarbonization resilience efforts. Joe?
Well, thanks so much, John. I really appreciate that, and appreciate everyone being here with us today. We're obviously very, very excited about the pledge, and so it's exciting for us to see so many people here on the line and to have a chance to discuss this initiative in more detail with you all. So, as John has said, we have in the Office of Climate Change and Health Equity and across HHS this bold vision for 2025, where we want to go, and we have progressively over the course of the fall been adding more texture and more detail to exactly what that means through the COP26 commitments he described and the executive order that came out in December. What that's meant is it's given us a real clear direction of travel inside the department and in federal health systems. And we're seeing commitments and detailed strategies from operating divisions and agencies that are on a scale and at a degree of detail that we haven't seen before. So it's very, very exciting for us. But as John says as well, we also realize that the majority of care provision in the country comes from the private sector. And that a number of organizations, both providers, but also other healthcare system stakeholders, among them suppliers and pharmaceutical companies, health tech organizations, group purchasing organizations, are already in motion on both climate preparedness and mitigation. And so what this pledge is meant to be is a way to celebrate those commitments and to build a bridge between our federal actions and the actions that are happening in the private sector. So if we go to the next slide, what I'm going to do is I'm going to walk through the details of the pledge, and I'm going to go element by element and kind of parse things out so that I think we answer some of the questions that are latent and that we've already seen in the chat. But I'll note that we will also have considerable time for question and answer and try to proactively address some FAQs when I wrap up here in a few slides as well. So what the pledge asks signers to do on a voluntary basis is the following. Number one, at minimum, reduce organizational emissions by 50% by 2030 from a baseline no earlier than 2008. And achieve net zero by 2050, publicly accounting for progress on this goal every year. So let me say a little bit more about some of the elements of that statement. So reduce organizational emissions by 50% by 2030. What do we mean by that? We mean scope 1 and scope 2 emissions. So that's what we're talking about specifically here. So those are, again, as John said, scope 1, the direct organizational emissions, scope 2, the emissions associated with purchased energy. That's what we mean by organizational emissions here. However, we have had some organizations already tell us that their goal is to achieve these reductions on all three scopes. So on scope 3 emissions, emissions associated with the supply chain as well, and that's something that we celebrate. We want to hear about. There's a space in the pledge document for you to tell us more about the work that you're doing. So we would love to know more about that if that's what organizations are doing. That's certainly something we celebrate. That's a direction that we know we all have to move in. And so, please tell us if that's what you're doing. But what we're talking about here is reducing Scope 1 and Scope 2 emissions by 50% by 2030 from a baseline no earlier than 2008. What do we mean by that? Well, we mean that 2008 is the year that federal organizations are obligated to use as a baseline in response to Executive Order 14057. So ideally, organizations would use that as their baseline. However, we know that there are some challenges getting some of those data. There have been mergers and other organizational shifts that might make that hard to access. So the request is that you share data from a baseline no earlier than 2008. So for example, if it was 2009 or 2010, that's okay. We would just ask that you specify that again in the pledge document in the open text area where you can tell us more about your work. And then publicly accounting for progress on this goal every year. What do we mean by this? We mean that we hope that organizations will make publicly accessible data on their progress. This is not something that will require to be submitted to the federal government. It's not something that we'll ask you to report, but it's something that by virtue of making this pledge, we certainly hope organizations will make publicly accessible. As a sub-goal here, we're also asking that organizations publicly share their strategies for reducing on-site emissions. So we'd like to know what you're doing where relevant, along the lines of addressing on-site energy usage, the release of waste anesthetic gases, electrifying vehicle fleets, and addressing refrigerants. Those are some examples of the areas where we'd like to understand the work you're doing and the approaches that you're taking for the purposes of shared learning across the country. The second element of the pledge is to designate an executive level lead for your work on reducing emissions by 2023. So really effectively by the end of this year, we would ask that the organizations signing the pledge have named someone in the executive office that is leading this work on reducing emissions. And that by the end of 2024, the organization conducts an inventory of Scope 3 emissions. So at minimum, inventorying Scope 3 emissions by the end of 2024, really looking inside that supply chain to at least identify the areas where there's the greatest carbon emission impact and where the organization might begin to take action in association with organizations that are a part of the supply chain. And then the third element of the pledge, the third area of focus, is asking those that sign to develop and release a climate resilience plan for continuous operations by the end of 2023, anticipating the needs of groups in the community that experience disproportionate risk of climate-related harm. The idea here is that these devastating disruptions in operations and in service that we've seen as a function of catastrophic climate events in the last several years is something that, as you saw in our vision statement, we hope to do away with entirely. And so we are seeking to hear from organizations on how they plan to address that, and specifically how they plan to address the needs of the parts of the community that we know are most vulnerable, that are likeliest to be harmed by the catastrophic impacts of climate change and also by the chronic disease impacts of climate change as well. So that's the starting point. In terms of the pledge, that's the initial explanation of it. But as I say, we're going to have more time here with some FAQs in just a moment to unpack this even more if you have further questions. But if we could go to the next slide, I just want to clarify a few additional points before we wrap up. One is that signers of the pledge can include all healthcare sector stakeholders that are not federal government institutions. So this certainly includes hospitals and health systems, but it also includes suppliers, pharmaceutical companies, device makers, group purchasing organizations have expressed an interest. So really, any organization that has a stake in healthcare, is a part of the healthcare system, contributes to the production of healthcare, as an organization that's eligible to sign the pledge. And all organizations that sign the pledge by June 3rd, which is our deadline for signing, will be acknowledged in association with a White House event we hope to have sometime later in June. And that acknowledgement will happen in the form of a fact sheet, which will name the organizations that have signed on. You probably have seen White House fact sheets in association with other climate-related events for other sectors. It will be similar to that. Some organizations could be invited to the event. Several of you have asked us who will be invited to the event, and we are unable to say anything about that. We just simply don't know at this stage. That's not decided by us, but it is possible that organizations that sign the pledge could be invited to attend the event. And I think maybe the last thing I want to say, and it could be the most important thing, is that we view this event not at all as a finish line. You know, signing the pledge doesn't mean we're done in any way. It's really a starting point on this work. And so if we can go to the next slide, you know, what we have planned once we launch the pledge is as a set of actions for actually achieving these public and private goals. So if you look at the four green boxes in the slide here, these are essentially our primary streams of work or strategies that we've already begun on to try to make it possible for us to all feasibly achieve these bold goals together. The first area of focus for us is surfacing the frontline reality. What do we mean by this? It means going out in the field and really understanding and listening to the challenges that communities and individuals and providers face in meeting the challenges associated with climate change. We've been doing this through regional listening sessions. We will have regional sessions in every part of the country. We are part of, actually co-chair through Admiral Levine, the National Academy of Medicine Action Collaborative on Decarbonizing the U.S. Healthcare Sector, which is a venue where private sector and government stakeholders, really stakeholders from everywhere that are working on addressing this problem are coming together to learn from one another and share challenges with one another. And we are issuing on a pretty regular basis requests for information from agencies across HHS to get feedback on how you think they can best support work on climate change. So there have been RFIs issued by the NIH and AHRQ last summer and fall. CMS issued its first RFI in December of this year as part of the notice of proposed rulemaking on its marketplace rule. CMS just issued another request for information as part of the inpatient rule, the IPPS rule, in that notice of proposed rulemaking. And that's open now, and we encourage people to give feedback there. And then we at OCCHE ourselves have recently released a request for information on our environmental justice strategy. So there are lots of venues for us to collect this feedback, and we're eager to really deeply understand in a textured way exactly what the challenges are out there in the field and how we can best offer support. The second area of focus for us is identifying evidence-based solutions and innovations, really tapping into the work of a lot of the organizations that are represented on the line here today to identify the best approaches to addressing resilience and addressing decarbonization, to codify those things and make them available broadly through supports that we introduce. And this is the third strategy here, supports that we introduce to healthcare sector stakeholders. So, you know, what we don't want to do here is announce this pledge and not offer assistance and support to organizations that are standing up and taking responsibility and signing the pledge. So our intention is that in association with the pledge event in June, that we will be announcing the first in a series of supports from the Department of Health and Human Services that will give technical assistance to those providers that are trying to do this work. And this includes everything from measurement supports and tools to toolkits on resilience and decarbonization to collaborative learning initiatives where organizations can actually come together and begin to do the hands-on work of applying the evidence base to actually making change. And then finally, you know, we are exploring all of the levers that are available to HHS. Secretary Becerra has often said we'll use every policy lever at our disposal to address this critically important work. So we're exploring incentives and regulations and measures and other things that at some point the department might introduce to advance this work. I hasten to say, whenever I mention that a big part of this work for us might be removing barriers that are currently in regulation to doing the work that organizations need to do to address the threats of climate change. So with that, I think we'll start to transition to the Q&A part of our session. I think we might have actually gone in the wrong direction there. So we want to go a few slides in the other direction. There we go. And we want to just start to address the frequently asked questions from the group. We'll be starting to answer the questions in the Q&A, but these are the questions that we have had come over the transom in the last 7 to 10 days in the time since we launched the pledge. So we're going to start to just answer these common, I guess you could say frequently asked questions now, and then we'll start to answer some of the questions in the Q&A as well. So maybe, John, I'll put you on the spot and pose the first question to you, which is a question we've heard maybe more than any, which is, how can you ask hospitals and health systems to sign this pledge when they're still burdened by the demands of the pandemic and other challenges?
Thanks, Joe. Yeah, we have heard this one a lot, and it's one that we're, of course, completely sympathetic to and cognizant of the fact that we are in the pandemic and that health systems are incredibly stretched and stressed. In some of the talks I give, I put up a slide that shows a sign from a senior center that's trying to take care of seniors in the midst of the pandemic. And the sign is in outside Napa, California, in the midst of a conflagration of wildfire. And it's symbolic of the fact that while it would be ideal for the pandemic to be the only thing we have to worry about right now, we've seen how certainly on the resilience side of health systems has been a huge issue in terms of fighting the pandemic and being able to provide continuity of services, whether that was in the wildfires of California, whether that was in the health system shut down by the hurricanes in the Gulf Coast or the heat waves here in Washington, D.C., which stopped testing programs. So, I think the sad reality is that we're in it, we're experiencing it, and that the very same things we have to worry about and think about in terms of the resilience, not just of our buildings and our energy supplies, but also our people, our workforce, they go hand in hand. The stresses that people are under from climate change stresses are being compounded, as happened in Texas when the freeze knocked out the power and all the healthcare workforce were sleeping in the units. The short answer is we don't have the luxury of waiting to address the climate crisis and until there are no pandemics or other serious health threats. The other piece of this, I mentioned the fact that the climate actions to reduce greenhouse gas emissions have a net economic benefit that outweighs the cost of those reductions. The same thing is true of a lot of the very first steps that hospitals and health systems are making to reduce their organizational emissions, to reduce their Scope 2 and Scope 1 emissions. Many of them are reporting to us, in fact, most of them are reporting to us, that it actually saves money and enables them to put those extra funds to things like taking better care of people during the pandemic. So we think that health systems are up to the task. We think that these things can be done at the same time. And in fact, they really have to be done at the same time.
And I think the only thing I would add to that is just to say, you won't be doing it alone. You'll be doing it with us. And our intent, again, is to be providing lots of supports and assistance along the way so that, this doesn't feel like a journey that you're going on by your lonesome, but something that we're all doing together as a national community of learning. The second question that we got quite frequently is about the data that organizations that sign the pledge will be required to submit. And the simple answer here is organizations that sign the pledge are not required to submit data to us or to the federal government in association with this initiative. So that is not a part of what we're seeking here. But again, we are asking that organizations make this information on their progress publicly accessible so that they share their progress with their communities and with others that would seek to see it. So we believe that transparency is very helpful for the purposes of learning and for the purposes of accountability, and we would ask that organizations provide that. We also will say that it is the case that there are other existing federal requirements and regulations that obligate some organizations already to do some reporting. So certain organizations that emit over a certain amount are already required to do EPA reporting. We know that there's a very well-known SEC notice of proposed rulemaking that came out recently that will obligate public corporations to do reporting, depending on how that is finalized, and so that's a possibility as well. There are lots of possibilities in the future, and as I say, some existing obligations. So while we aren't requiring submission, there are other federal programs that either do or could in the future. The last very frequently asked question that we've had is this pledge really relevant to organizations that are not healthcare providers? So we've had a really encouraging amount of interest from pharmaceutical companies, from health tech organizations, from other suppliers, and they're wondering, is the pledge really for them? And our answer, the short answer is absolutely yes. And we think every element of the pledge is relevant to those organizations. So it's certainly the case that organizations have facilities. Facilities have emissions associated with them and emissions associated with purchased energy. And so the first element of the pledge would be quite relevant to them. The second element of the pledge, which has to do with assigning executive leadership and understanding supply chain emissions, is also relevant to most of the organizations that we can think of that are a part of the healthcare sector. And then the third element, which has to do with resilience, which is where several organizations have asked us, if they really contribute to the resilience of the healthcare system. Our answer is absolutely. You might not be providing direct care, but having an organization that doesn't have disruptions in operations is very important to the degree that you're contributing, even if it's further upstream, to the production of care. And so we think that's critically important as well. So there really should be space for your organizations to take part. Again, there is this open field if you want to explain things or express how you're approaching this, but we think the field is really open to that. Looking at the question and answer that's come in, there are a number of questions, and we're very, very appreciative of those.
Joe, could I pause you for 1 second? I just wanted to go back, looking at the questions, there was this, I want to just emphasize one thing, and I think it would be a good place to interject the role that the National Academy of Medicine is playing in the public-private partnership. I'm not sure that we explain that in great detail, but when we're talking about the questions about what metrics will be used, how specifically should the healthcare systems be thinking about reporting, there is an active collaboration going on, an action collaborative of the National Academy of Medicine on decarbonizing the healthcare sector that's pulled together a lot of the leading professional organizations, leading experts to address these questions and to come to some kind of agreement about the steps. And again, as Joe said, that's in the future to determine, exactly what the metrics will be. We don't have a singular metric for all organizations yet, and it's separate from the actual commitment. Joe, did I get that right?
Yes, thanks, John. So I'm looking through the questions here now and just trying to select ones that I don't think have been answered yet, just to try to make our time as efficient as possible. One question that comes in is about the timing of the pledge and submitting the pledge by June 3rd, and noting that committing to the pledge within a month may be challenging. And I'll just note that if that is the case, we'd like to hear about it. We certainly have it within our power to extend by a few days if need be. We'd really like to keep to that timetable, though, because we hope to have this event in June. But if that is a concern or challenge, I'll say, please let us know, and we'll consider it. Another question that's come up that I think could be broadly useful to the group is to do with, I've just lost the question on the screen here, it says, how does the HHS Climate Pledge align with the Science-Based Targets Initiative? And, I think the answer to that question is that those are worthy, helpful standards that are out there. The GHG protocol is another that comes to mind. And organizations can make commitments to these standards. And if you do, if you're working on that, we'd very much like to know about it. But that is not at all a requirement of this pledge. And so those are valuable tools. And, you know, we hope to make organizations aware of supports like those in the future, but we're not requiring adherence to any particular standard as a part of this pledge. So that's the reply to that question. Just trying to get again to questions that feel like they're kind of universally
Joe, there's
relevant.
a few questions about offsets and the role of offsets both in the 2030 and in the longer term goals.
Great, John, do you want to take that, or do you?
So, you know, there was a question about can carbon offsets be included, and are offsets a part of the 2030 the goal target? And the 2030 goal target is an absolute reduction, but the phrase net zero implies the possibility of offsets. 2050 is a ways away. We hope that we get not just to highly offset emissions, but as close to zero emissions as possible. And there's also a question in the chat about whether those absolute reductions by 2030 are normalized based on changes in the size of the system. And Joe, I don't have the answer to that, but I'm going to pass the answer to that question back to you.
Yeah, I think I would say let us follow up on that. I think that is probably the best answer to that. I just want to check one, and then we can fully answer that question. But I think you've given you've answered sort of the core part of the question there now. I want to take a few other questions if we can before we have to wrap up. The first is, and John, this might also be in your wheelhouse. The federal government and HHS provides funding for biomedical and health research. Research institutions are not clearly called out amongst the list of stakeholders that are a part of the pledge. Will OCCHE be working to connect expectations for efficiency, sustainability, resiliency, and greenhouse gas reduction to federal funding for biomedical or health research, such as funding from NIH?
That is a great question. It's something that NIH has been working on intramurally for a long time, and also doing some external collaborations. The research arm has not been a formal part of this pledge, but as Joe said, other institutions are certainly welcome to join in. But there is another set of activities associated with the Climate Adaptation Resilience Plan that we published last fall that deals with aligning our grants policy as much as possible towards the goals of decarbonization and resilience. And so we're in active conversation with NIH and with the Office of Extramural Affairs there as to move as much as we can with NIH in terms of the grant policies to move biomedical research institutions towards decarbonization and resilience as well.
Great, thanks, John. I'm going to answer one more question that's come up, I think, 3 times here, which is related to how will we post the names of the organizations that have signed on. And the answer to that question, again, is that there will be a White House fact sheet in association with the event, which is kind of like a media release, but it's a White House sheet which describes what's being committed to, the work that's being done across the sector, and all of the organizations that have signed. So that will be the primary venue for recognizing organizations that have signed the pledge. It might be done elsewhere. You know, I could imagine other areas where that would be done, but that'll be the primary way that organizations will be recognized. So we're at time here. There are a few other questions in the chat, which I think are more specific, related to specific organizations' questions. And again, I would echo what Christina has said, which is that please approach us with those questions at OCCHE at HHS.gov, and we'll be glad to answer those as they come in. We're excited about your interest and your curiosity, and we want to respond to that as quickly as we can. We want, of course, to encourage you to sign the pledge. You know, we'd be delighted to have you join in. Several organizations have done so already, and we'd love to add you to that group. And then, you know, we will be posting this webinar on our website sometime in the next few days, and we'd invite you to share it with others, to share the recording so that they can access it as well. And beyond that, we're looking forward to celebrating with many of you in June. And if you can't sign the pledge, certainly we understand, and still look forward to lots of collaboration and work together in the months to come. So with that, I'll turn it to John for a final word, and we will wrap up.
Great. Well, I just want to echo what you said, Joe. The gratitude to the participants today. Your questions have been fantastic. Your suggestions are well received, and we will do all we can to address the issues that you're raising. So please stay in touch. Please visit us online, and if you have not already, sign up for our listserv. For the Office of Climate Change and Health Equity. This is our most direct way that we communicate, and we'll be providing updates. And thank you for joining today. With that, I think we can close. Christina, back to you for any final instructions.
Nope, all good. Thanks, everybody. Have a great day.
Thank you all.
Produced by the U.S. Department of Health and Human Services.